You know, since the early part of the 20th century, doctors from Massachusetts to California have been doing intravenous hydrogen peroxide therapy. It's an interesting thought because everybody knows about hydrogen peroxide used in cuts and wounds and things like dirty, infected cuts and things, but hydrogen peroxide, just a tiny dose, maybe a half a teaspoon in a bag of IV fluids, can be amazing in helping our body to get rid of microbes and issues that are sensitive to hydrogen peroxide. One of the ones that we do recognize is the overgrowth in the gut and in other parts of the body of Candida, or yeast as it's known as. And so we're big believers that when we can help the body to excrete these microbes, the Candida microbe, we can get healthier from it. Peroxide is very simply done. We don't do it fast because it is hydrogen peroxide. We do it over 1 to 2 hours, and therefore we don't irritate anybody's veins. When we do hydrogen peroxide therapy, we do use pharmaceutical-grade hydrogen peroxide from their pharmacist. It's not just something you buy over the counter, and it is measured and it is done in precise amounts. So this is very specific for each person, very well accepted and very well received, and seems to be quite effective in helping. In fact, the first studies, believe it or not, were done at Massachusetts General Hospital on people with the Spanish influenza back in 1918, and they were able to show more than cutting in half the amount of deaths and disease that people afflicted by the Spanish flu were having happen. So we know from very early days that it has benefits. It's not as well accepted in hospital-based, convention-based medicine, and that's okay. We do feel like we're cutting edge and at the frontier of medicine here, and therefore eventually, maybe from some years from now, many more physicians, conventional or convention-based medicine, will be picking up on this wonderful therapy that's been around for over 100 years. You know, you can come try it because if you have concerns of health, oftentimes a questionnaire or just a history and physical examination, we can detect some of those issues, and we may recommend hydrogen peroxide IVs as part of your ongoing detoxification and also part of your getting rid of microbes. So it's not just something you want to be considering at home. This is really meant to be done under medical supervision, and that's why we're here at Natural Medicine and Detox.